Ponstan Forte 500 milligrams is a commonly used pain-relieving and anti-inflammatory medicine. Its main ingredient is mefenamic acid, which belongs to the group of medicines called NSAIDs, non-steroidal anti-inflammatory drugs. It works by reducing pain, swelling, and fever in the body. But many people don't realize that wrong use can cause serious stomach, kidney, and heart problems. Uses of Ponstan Forte 500 milligrams. Ponstan Forte is commonly used for menstrual pain, period cramps, dysmenorrhea, toothache, muscle pain, joint pain, arthritis, back pain, headache and migraine, pain after surgery or injury, fever. It does not treat the cause of disease, it only helps relieve pain and inflammation. Dosage of Ponstan Forte 500 milligrams. The dosage depends on the patient's age and condition, but the general adult dose is 500 milligrams, 2 to 3 times a day taken after food. Very important to protect your stomach. With a full glass of water used for short-term pain only, not long-term without medical advice. Never exceed the recommended dose. Overdose can seriously damage your stomach, kidneys, and here. Side effects of Ponstan Forte: stomach pain, heartburn, nausea or vomiting, diarrhea, dizziness, headache. These are usually mild and go away when the medicine is stopped. Serious side effects: need urgent help, chest pain or shortness of breath, swelling in face, lips or throat, severe skin rash, decreased urine output, kidney problem. If any of these happen, stop the medicine immediately and seek medical help. Contraindications: who should not take Ponstan Forte? You should not take this medicine if you have stomach ulcer or gastritis, you have kidney or liver disease, you have heart problems or high blood pressure, you are allergic to mefenamic acid or other NSAIDs, you are taking other strong painkillers or blood thinners. Always inform your doctor about your full medical history before using it. Can be used in pregnancy. Ponstan Forte is not recommended during pregnancy, especially in the 3rd trimester, because it can harm the baby's heart and kidneys, cause complications during labor, increase risk of miscarriage. It should only be used if a doctor decides the benefit is greater than the risk. Never self-medicate during pregnancy. Can be used in breastfeeding. Small amounts of mefenamic acid can pass into breast milk. It is usually avoided or used with caution in breastfeeding mothers. If it must be taken, the baby should be watched for vomiting, diarrhea, rash, unusual sleepiness. Always ask a doctor before taking it if you are breastfeeding. Ponstan Forte 500 milligrams is effective for pain and inflammation, but it is not a harmless tablet. Use only when truly needed. Take it after food, never overuse it, avoid self-medication. The wrong use of painkillers today can cause serious damage tomorrow. This video is for educational and awareness purposes only. It does not replace medical advice. Always consult a qualified doctor or pharmacist before taking any medication, especially if you are pregnant, breastfeeding, or have any medical condition. Thanks for watching.